Texas Senate Bill 12 is a state law that went into effect on September 1st. Its aim is to strengthen parental rights in public education, but part of that law requires schools to obtain parental consent before administering health care services to students. That has led to confusion for campus nurses and parents alike. Angel San Juan has more in this week's Crisis in the Classroom.
Jackie Martinez wears many hats at Hamshire-Fannett ISD. She's a health science teacher, but she's also a registered nurse who serves as the district's nurse coordinator, making sure your children remain healthy or get the care they need in emergencies.
In an emergency situation, in an emergent even situation, we are still treating the children. We just need parental consent.
That parental consent requirement is now state law, but it's led to confusion among many parents who wonder if their child will get medical treatment at school if necessary. Martinez says some school nurses have experienced the same hesitation.
The trickiest part of this is the legislation didn't come out and TEA didn't release a lot of this until 2 or 3 days before September 1st. And so a lot of school districts were having to, quickly get this information out to parents, and so it's left a lot of confusion. Luckily here, our parents are always willing to talk to us, so we kind of are a team in trying to get that done.
Martinez says transparency and increasing parental involvement is what lawmakers had in mind when they passed the legislation. Yet there have been different interpretations that are creating challenges, which the state is dealing with almost daily.
Just this morning, they have released some new guidance on what is first aid and what nurses can do within their scopes, with or without parental consent. So some of that is still being worked out, and I think that's just part of, this new bill and new things that districts are having to work through.
Martinez and Hamshire-Fannett ISD are doing what they can to clarify the situation, using social media to keep parents updated on what they need to know and do, providing them the consent form at their fingertips. So you can opt into all of them or some of them?
All of them is on the form, but we have talked to a couple of different parents that have had some concerns, and so we've asked them to just let the campus nurse know, what their concerns are. We talk through it with them, and then also have them give us in writing what they want as far as what their child can receive.
Martinez assuring parents the health and safety of students are still priority. In Hamshire-Fannett ISD, I'm Angel San Juan.